everyone, my name is Jasleen.
I'm Logan.
Yvonne, you ready?
I'm Zach.
And we're students from University of Charleston School of Pharmacy, and we are here to present about Script Your Future and Generation RX. First off, let's start with the objectives. Discuss the 5 steps to become medication smart. Define asthma and discuss the effect of the disease on the body. And the last one is identify and discuss the proper ways to dispose of all, prescription medications. So, not taking your medications as they are prescribed can put your health and future at risk. And as you can see, 1 out of 3 people never fill their prescriptions. Nearly 45% of the population has one or more chronic condition that requires medication, but they're not taking it. And nearly 3 out of 4 Americans don't take their medications as directed. And more than 1/3 of the medication-related hospital admissions are linked to poor adherence. So as you can see, not many people are taking their medications as they're supposed to take. And that can cost Americans a lot of money, and about $290 billion per year. As you can see, that is a lot of money. So how can you be medication smart? What is the name of the medication and what are you taking it for? You should make sure that you know that. How and when do you take the medication, and for how long are you supposed to take it for? What foods, drinks, other medications, activities should you avoid while taking those medications? Are there any side effects? What are they, and what do I do when they occur? And lastly, how do you store those medications? And next up, Jordy will tell you more about it.
So we have with us Pill Bottle Pete, and he's our prescription bottle, and this is where our medication is going to be kept. We do have 4 prescription bottles going around, and if we could just split in 4 groups and have a prescription bottle per table, that would be good. There is some information on the bottle that we would want you to know. Now, every prescription bottle should have your name. The name of the medication that you're taking, the strength, the dose, how often you take it, your doctor's name, and the date it was issued. So those are things that we want you to know. Like every time you pick up a prescription from the pharmacy, or you have your doctor write you a prescription, and your mom or your dad had to go pick it up. Those are things that we want you to double check. Make sure the prescription that you're getting is actually yours. So we're going to do a little exercise. Can anybody identify what's the name of the medication on any of the prescription bottles that you have? Good job. That's right. So now that we know how to identify our medication when we see it, we're going to talk about having extra labels on our bottle that doesn't come with every prescription. And these labels we call auxiliary labels. And what they basically are extra information as to what or how you can take your medication. Some medication allows you to take it with a full glass of water. Some medication wants you to take it without food. Some medication wants you to, your doctor may want you to take your medication at a certain time. On empty stomach. So these are all going to be placed on the auxiliary label that's going to be put on the side of your bottle, extra from your actual prescription label. So what are we going to be concentrating on today is talking about asthma. Now, how many people have actually seen somebody playing, like you were playing in the playground, and you've actually seen somebody fell or got short of breath and called for help? Well, that may have been an asthma attack that you may have witnessed. And what asthma really is a chronic disease that causes your airway to get inflamed and makes it hard for you to breathe. And there are some things that trigger asthma that we're going to talk about, and they're very common, like pets. If you have pets around and you have asthma, that could trigger your asthma. Exercising. If you're running a little too harder than you usually do, that could trigger your asthma. Pollen, like going from one season to another. We know we go from winter to summer to spring, and we have all these beautiful flowers. But what happens? The flower releases pollen in the air, and when you breathe those in, that could cause trigger to your asthma. Extreme emotions, extreme weather changes. We could go from a hot weather to a cold weather, like from summer into winter. That could trigger asthma as well. Smoke. You could be around someone who smokes, or you could inhale the secondhand smoke. That could be a trigger for asthma too. Chemicals, dust mite, and like we said, exercise. If you exercise more harder than you usually do, that could cause you to, have an asthma attack. And of course, stress. So now, Logan's going to talk to you more about how you control your asthma and what do you do when you have an attack.
All right. So one of the first steps in controlling your asthma is to develop an asthma action plan. We'll pass around a couple copies of it you guys can look at. This example of an asthma action plan. But a big part of that is knowing your asthma triggers and how to avoid them. Like if it's a certain season or a certain animal, you want to avoid it, That's one of the first things you can do. But then you also might have some asthma medications. So you want to take your asthma medication as prescribed. Maybe an inhaler or something that you take a couple puffs of every day. You're going to want to track your asthma and recognize when your symptoms are getting worse. That might include things like, your shortness of breath, or it's a tightness in your chest, or you're getting a dizziness feeling. They list these symptoms on your asthma action plan as well. And when it does get worse, you want to know what to do when your asthma becomes worse. Take action. That'll be on your asthma action plan under like the yellow and then red lights there, like a stoplight. So you might want to, have a rescue inhaler or something, or eventually you're going to want to see the doctor when it gets worse enough for your asthma. So a couple of asthma medication devices you or your loved ones or friends might use. The first one would be inhalers, pictured here, which are also known as metered dose inhalers. They're commonly used to deliver asthma medication. This is one of the more common ones you might see, especially like friends use or something. And they might come with a spacer, a holding chamber, which can be used with metered dose inhalers to make it easier to use and increases the amount of medication that reaches your lungs. This other one pictured here is called a nebulizer. Nebulizers are another device that can be used to deliver asthma medication. They're used by placing the mask over the nose and mouth, and some may be held in the mouth while delivering the medication. So how to use your medication device? If you have a metered dose inhaler, you're going to want to first remove the cap and hold the inhaler upright. Next, you're going to want to shake the inhaler. You're going to tilt your head back slightly and breathe out. You'll get all the air out of your lungs. Next, you'll hold the inhaler upright and press down the inhaler to release the medicine as you start to breathe in slowly. So it's all one big breath. You breathe out, and then you press it down, release, and as you're breathing in the medication. You want to breathe in slowly for about 3 to 5 seconds, and you're going to hold your breath for 10 seconds to allow medicine to go deeply into your lungs. And they'll specify these as you get your medication, specify it with your prescription on your asthma action plan as well. And you'll want to repeat the puffs as directed. If you need to, you can take a certain amount of puffs per an hour or day. You're going to want to wait 1 minute between the puffs to allow the second puff to get into the lungs better for the full, the full breath effect. You want it to get really down in there to help you to breathe easier if you're having an asthma attack. And next, we'll talk about safe medication disposal.
Okay, guys, we know that we use medications to treat different conditions and different disease. So what do we do with the medication when we do not need them? So we are going to learn some proper ways to dispose your medications if you do not need it. These ways are going to help us help us prevent our environment, not so that we do not harm our pets, our friends, our younger ones, and all of that. So who thinks that pouring pills into the trash is a proper way for disposing medication? Anybody? Okay, let's find out. No. If you want to pour your medication in the trash, it is very important for you to put it in a sealed container, and we are going to demonstrate how to seal those containers for you later in our presentation. So why do we put in a sealed container? It's because, like we said, we do not want to just put our medications in the trash so that our pets can get it from them, our younger ones can get it from them, or we can potentially harm our environment or something like that. So we want to make sure that we dispose this medication in a way that it is safe, and it is safe for our environment, and it is safe for anyone else around us. So how else can we dispose medication? So does anyone think that flushing unwanted pills, liquid, patches in the toilet is a safe way to dispose medication? Anybody? Okay, let's find out. No. So when we flush our pills or our fluid in the toilet, it is very important to remember that it is going to come back to our water system, and it's going to harm us and our pets too, because we have some fishes in the sea, we have some animals that can come in contact with these chemicals in our medication, and it will potentially come back and harm our environment. So it's very important for us to have it in mind that flushing our medication in the toilet can still come back through our water system and affect us, and we do not want that, right? So those are some of the things that you should do and you should not do with the medications that you do not need. So we are going to continue learning how we can dispose medications that we do not need.
So I'm going to ask you guys a basic question first. How are we supposed to dispose of our medications? How do you all dispose of your medications? Can you give me a couple examples of how you do it? Okay, that's a good idea. Okay. So let's go over a few options that we have. Our first option is going to be the medication take-back programs. This is sponsored through the DEA, and it's a National Prescription Take-Back Day. It's one day a year, and different people and facilities participate in this day, so you can bring your medications to these facilities, places, designated locations, and you can bring your unwanted prescriptions back and dispose of them properly. So, who knows what the DEA is? Okay, you're almost there. It's the Drug Enforcement Agency. So what better people to be taking care of this situation than the Drug Enforcement Agency? So local police stations almost always get involved in this day. You have the Nitro, St. Albans, South Charleston, Dunbar. Now, do you all live in these places? Do you live around Nitro, Dunbar, St. Albans, South Charleston? Yeah. So on National Take Back Day, these are going to be designated locations to where you can take your prescription drugs back. Now, the next option that we're going to have is disposing of the medications at your home. So, how many of you all cook with your parents? Okay. Do you follow a recipe? Right. This is your recipe for disposing of prescription medications at your house. So, our first step, we're going to mix the medicine with cat litter, coffee grounds, or dirt. Do you all have an animal? Does your mom or dad drink coffee every morning? Right. So, you have the items available to you, and all you have to do is mix these items with the medications. So, step 2 of our recipe that we're following is we have to place our mixture of, let's say, the coffee grounds and the medicine in a sealed container. The sealed container, it needs to be something like a plastic baggie that has a little zipper on it, so that way if we drop it, if it gets thrown somewhere, nothing's going to spill out of it. Or we could use, for instance, a large jug, like a milk jug. I'm sure all of you drink milk because you want to grow up to be strong and have good bones and all the good stuff, right? Right. So, that jug is going to have a lid on it. Be sure you have that lid screwed on tight so nothing falls out of it. Now, moving on to step 3 in our recipe, we need to throw the container in the household trash. Now, as long as it's in the container, it's mixed with something, it's sealed tight, we can put it in the trash for disposal. And then make sure your trash gets thrown away properly, it doesn't spill out anywhere. Now, all the while doing this, what are you going to do with the information that was on the bottle? Do you have any ideas? Yeah. Okay. So, the important point is make sure all your information has been removed from the bottle, from the medicines, any piece of information. Be sure you scratch off or peel off the label. Get rid of your name. Take your birthday off. You just don't want nobody to have your information but yourself. And that's always good to do when you throw anything away. So next up, we're going to be talking about another disposal system.
All right, so I'll be talking about a medical disposal system. So then this comes in a pouch and it can safely dispose up to 45 pills. So I'm going to go through the directions on how you can use it. So first things first, you want to open up the pouch. That way you could actually put the items in. And then you're going to pour in the pills. So I would recommend trying to get this to be one shot so you don't have to like pick off any pills off the floor. If you do, that means you kind of lost and you lost a little time, but that's okay. Just remember that little game I said. Always pour in those pills and miss none of them. And then next you're going to fill it halfway with water. This is pretty important. If you fill it all the way full, it's going to be much harder and it's going to be easier to basically break if anything happens to it. And then finally you're going to seal the pouch and gently shake. That's going to basically destroy all the pills in there and it'll render the composition ready to dispose. And then after that, you just throw it out with your household trash. And yep, it's as simple as that. Now I'm gonna ask you a few series of questions, so I'm gonna want you to put on your thinking caps. So I'll give you a little moment to do that. All right, are you guys ready? All right, now the first question. So what are the effects of asthma on the body? All right, any volunteers? Don't all rush up now. All right, next question is, what are the common triggers of an asthma attack? So, common triggers. Any ideas here? All right. And how would you control asthma and recognize the signs and symptoms of an asthma attack? This could be something that could occur, like, on a playground. What would you be looking for? All right. That's a good answer. And next, I hope you remember everything we talked about in the asthma action plan. This would be your red, green, and yellow lights. I have no idea why I just set all the stop lights in out of order. But yeah, Next, what are some of the devices we use to deliver asthma medication? One of them could be that's right, a nebulizer. And then next, how would you properly use your asthma medication device? So if there's anything I hope you guys learned today, it's not to do this with your asthma, with your inhalers. That is not the proper way to take the medication. It's not even going in your lungs, so it's not going to do anything. Hopefully you remember that. And then what is the importance of safe medication disposal? So that would be something like, say, what would happen if the medication fell into the local river or landed on the ground and one of your pets ate it? What would happen then? And then the do's and don'ts of disposing of medication. I think it's much easier to remember what you shouldn't do. So what are some things you shouldn't do? All right, that's absolutely correct. Don't flush it down the toilet. And where are some locations you can dispose of medication? Any ideas? All right, police station, yep. And finally, how to use the safe medication disposal system correctly. This is the last thing we went over. Hopefully you guys remember. And if you guys need any, you can just ask us and we'll be sure to give you one. And thank you for your time, and any questions?